Hello folks, and welcome back to my channel. A little bit ago, we discussed some intricacies and considerations for getting nipple piercings if you've had breast augmentation or breast implants done. Today, I'd like to do a follow-up video to that, talking about considerations for nipple piercings if you've had breast reduction surgery done. Now, breast reduction surgery is a surgical procedure designed to reduce the size of the breasts and make them smaller, and also potentially change the placement and the aesthetics of the breast as well. This is achieved through the removal of skin and tissue from the breast, followed by a process of reshaping and readjusting. Now, there's no one singular way to get a breast reduction, and the type of breast reduction you have is going to greatly affect your ability to be pierced afterwards and your time frame for piercing afterwards. Now, the most minimally invasive way to have a breast reduction done is through liposuction, where a small tube is inserted through small incisions in the skin and fatty tissue is removed from the body. Liposuction is a very minimally invasive way of getting a breast reduction done that's going to leave very minimal scarring, but it's also going to have slightly more minimal results. Liposuction is really only ideal for folks who are looking for a small change in size and shape of their breast and not anything major. Liposuction is ideal for those whose breasts are mostly fatty tissue and who have very good skin elasticity. If you don't have great skin elasticity, you're going to end up with some sagging and just some unpleasant side effects from liposuction. So it really takes specific anatomy to be a good candidate for liposuction as your reduction type. Now, with liposuction, the overall shape of the breast, the overall size, and the location of the areola and nipple all stay about the same. They just kind of reduce the size a little bit. Liposuction is probably the least common form of breast reduction that I see through my studio, and it's also the one that has the least amount of effects on piercing. With liposuction, they're not really doing anything to the nipple, the areola, or the nipple stalk, the glandular structures and blood flow and nerve endings that connect to the nipple from inside the breast. So most of the time, liposuction doesn't affect us being able to pierce at all. There's no incisions near the nipple, nothing really about the placement or anatomy or structure of the nipple has changed. You should be fully healed up from your procedure just due to swelling, healing, and infection considerations, and that can be anywhere from about 3 to 5 months. That's how long it takes your body to really fully heal from lipo in an area, and after that, you're good to go to get pierced. So if you've had a breast reduction done with liposuction, good news, your considerations for nipple piercings are almost the same as someone who hasn't had anything done. You just need to wait for your lipo to be fully healed in order for it to be safe to pierce first. Now, other forms of breast reduction are going to be much more surgical and have much more of an effect on nipple piercings and our ability to pierce afterwards. And the two primary types of breast reduction I typically see through my studio are lollipop incision breast reductions and inverted T-anchor breast reductions. Lollipop incisions get their name because a vertical incision is made up along the breast, and then a little circular incision is made around the areola, kind of forming the shape of a lollipop. This vertical incision is really good for folks who need like a mild to moderate change in the shape and size of their breast. And it also allows for working with sagging and kind of creating a little bit more lift. That vertical incision allows for the removal of glandular tissue as well as fatty tissue, which gives surgeons a lot more options for how they reshape and create the new breast afterwards. And the breast is typically made narrower, lifted, and reconstructed, with the nipple and areola being relocated to a better placement that's more aesthetically pleasing. Now, when it comes to lollipop incisions, we do have an incision directly around the areola, and the nipple is typically being removed from its original place and moved somewhere else. Now, most of the time with lollipop incision, that nipple stalk, that internal structure with lots of glandular tissue, milk ducts, lymphatic glands, nerve endings, and blood flow is still being kept intact. So they're not completely removing your nipple off of your body and putting it back on somewhere else. They're usually just removing the nipple from the tissue around it, keeping all of those underlying structures intact, and then relocating it to a better placement as part of the breast reduction. This has a couple different effects when we consider piercing afterwards. The first is a little bit of the cons, which is that we are literally moving the nipple to its new location, and that scarring does take a while to heal. Like, your areola has literally been removed from the surrounding tissue and put in a new place and stitched to new surrounding tissue. That is going to take quite a bit of time to heal up and be ready for us to consider re-piercing. Now, the plus side is that that glandular structure is still intact, so the nipple still has good blood flow, good sensitivity, good range of motion, and there's not as much scar tissue as there could be. So as a general rule of thumb, I usually say 1 year post-op from a lollipop incision breast reduction in order for us to be able to safely pierce. Now, like anything, nipple piercings are anatomy dependent, and that includes after a reduction. I do find that with any incisions that go around the nipple, sometimes this can cause the nipple to change shape. And if the tissue of the areola is pulled very taut when it's sutured back onto the skin, sometimes this has the effect of flattening the nipple out a little bit and making it less protrusive. If the nipple isn't protrusive enough for us to pierce, it's not protrusive enough for us to pierce, and there's not a safe way of us doing a piercing for you. I find that clients who already had nipples that were a little bit on the flatter end of the spectrum or completely flat before a breast reduction, if they get it with a lollipop incision, things are oftentimes even flatter afterwards, and that means that it's not viable for us to pierce. Likewise, if the scarring from the lollipop incision is very severe, sometimes people deal with hematomas or issues with how the scar tissue forms and adheres. That could also be a factor in it not being safe for us to do a piercing afterwards. So you should always be getting a consultation with an experienced, reputable piercer who does a lot of work with surgically altered breasts, who can assess your anatomy and say, yes, it's totally safe for us to pierce these, or no, and here are some reasons why I don't think you should get your nipples pierced afterwards. Now, the other incision type I mentioned is an inverted T incision, which is the same incisions as a lollipop, where you have that incision around the areola and that vertical incision down the breast, but it's coupled with a horizontal incision underneath the breast in the crease where it meets the body, which creates an upside down T, hence the name inverted T anchor incision. This style of incision allows for the greatest amount of tissue being removed and the largest amount of reshaping when it comes to a breast reduction. This is really ideal for folks with significant sagging or who need a significant reduction in breast size, but it's also the most extreme way of doing a breast reduction, and it has the longest downtime. Most surgeons state 1 full year of healing and recovery in order for that tissue to be fully settled, and some surgeons who have different approaches to how they do this even say that you'll be seeing changes in your results for up to the first 2 years. Now, the same concerns apply when it comes to the nipple, that it can be moved around and relocated, and that scar tissue does create some new challenges when it comes to piercing. So just like with lollipop incisions, it's important to have a piercer check your anatomy. It's important to wait until you're fully healed after surgery. And it's also important to understand that depending on your surgical results, you may be losing the anatomy for nipple piercings, even though you're gaining breasts that are a size and shape that's more desirable to you. With inverted T anchor, please listen to your surgeons and your doctors as far as your healing time and downtime. That lower incision does create a more complex healing process where things like raising your arms above your head can stretch out that incision, cause damage, cause issues, and the incisions and everything being held together is a little bit more fragile. So it's really important that we don't pierce through the nipple until we're sure all of those incision sites are really well healed and really healthy. In this instance, my really big concern is infection. If that piercing ends up getting infected and it potentially spreads to those areas of the incision before they're fully healed and fully stabilized, that could cause some very serious long-term problems and can even cause you to need a revision on your reduction, and that is just not worth the risk. So depending on the exact specifics of your inverted T anchor, it'll probably be about a minimum of a year wait time before it's safe to pierce again, but it may be even longer. Now, it's worth noting when I'm talking about breast reductions, I am not inherently talking about a breast lift. A breast lift is a separate procedure designed to lift the tissue of the breast and have more fullness and more fatty tissue along the upper portion of the breast that creates that nice cleavage look. Breast reductions and breast lifts are not the same surgery. Now, many clients may choose to combo a breast reduction with a breast lift or even with implants. And if you're interested in how implants are going to affect you getting and having nipple piercings, I'll link my video about them here, and feel free to go ahead and check that out. But in this instance, if you are coupling your reduction with a lift, it's important to consider how that's going to affect your nipples when it comes to piercings. Many doctors opt to do a reduction and a lift as 2 separate surgeries with some downtime in between to allow the body time to heal, the tissue time to heal and recover, and in order to allow for the best possible results. If that's the case, we don't want to do any piercings for you until after the second surgery is fully completed and fully healed. So if you come in to see me, you're healed from your breast reduction, you're ready to get them pierced, but then you let me know, oh, but I'm going to be having a breast lift in 6 months. I'm going to be like, why don't we wait to do these piercings. I know you're very excited about getting them done, but you're probably gonna have to remove them for your lift. It's gonna change how things sit and lay again, and it's gonna be a further risk of infection and issues during the healing process. And you're spending so much money, time, energy, and effort in getting this reduction done and getting the body you want. I don't think it's worth it to potentially lose all of that over just wanting to have some piercings. So I definitely suggest waiting. Now, of course, I can't talk about breast reduction without also talking about nipple grafts. Nipple grafting is the process where the nipple is fully removed from the body, from the tissue surrounding it, and from that nipple stalk and nipple buds that rest below the surface that have all of that glandular structure, blood flow, things like that. Nipple grafts, they take everything off, they resize and reshape the nipple, they cut down some of the areola, and then they literally take like a little cookie cutter and cut out new holes and then graft those nipples into their new placement on your body. Nipple grafts are not super common when it comes to breast reductions, but I have occasionally seen clients who have gotten grafts as a part of their reduction healing process. Grafts are a different beast when it comes to piercing through them. Because we've removed all of that underlying blood flow, structural tissue, nerve endings, things like that, these do not respond like nipples that still have all of those connections. They have quite decreased blood flow. There's usually a lot more scar tissue. They're much slower to heal. They're a much higher risk of infection and irritation. They're also a much higher risk of rejection and migration. And in this instance, since we're talking about surgically altered tissue, especially with different reduction types, migration or rejection on a nipple piercing could potentially permanently affect the results of your reduction. So if you've had grafts done, I typically suggest, again, minimum of 1 year, sometimes minimum of 2 years, depending on how the graft was done and how it's healing, just because so much healing and development happens over the course of those first 2 years. Your nipple can change shape and size a lot in that time period as it recovers from being grafted. And we really want to allow all of those changes to have fully occurred and the area to be fully healed before we add on the stress and pressure of healing a piercing. I talk a little bit more in depth about nipple grafts in my top surgery and nipple piercings video because grafts are a lot more common with top surgery, but I still wanted to mention them here in this reduction video because I do occasionally see reduction clients who've had grafts. And then we have to have a little bit more of an in-depth discussion about the risks of piercing through grafted nipples, what we need to look out for, what we need to consider, and have a very frank and honest anatomy assessment if their grafted nipples are even going to be viable to be pierced through after being grafted. When it comes to getting a reduction done, I think that's probably one of the most incredible, life-changing procedures. All of my clients who have had reductions have nothing but great things to say and are very, very happy with the choice that they've made. While a reduction is not in my future, I can relate very heavily since I am planning on getting top surgery. I don't even want any of these left, just take it all. So if you're thinking about getting a reduction, I'm so happy for you. I'm so excited for you, and I hope it's everything you dream of and more. If piercings are your goal post-reduction, I just ask that you have some reasonable expectations and understand that the process of getting a reduction is going to permanently surgically alter your breast and your nipple, and the ways in which that alter things may make it not safe for you to be pierced afterwards. So please make sure you're considering that when you're opting to get a reduction. I still think you should get a reduction if you want one. I just think you should have reasonable expectations for the fact that it might not be safe to pierce you afterwards, and if it is, you might have to be a little bit more patient than you expect before you're ready to get that piercing. I hope this video helps if you're considering getting your nipples pierced and you've had a reduction, or if a reduction is in your future. Thanks so much for hanging out and chatting today, and I hope you have an awesome rest of your day. Bye!